HHS Secretary Robert F. Kennedy Jr. is declaring a war on processed foods and added sugar. The White House unveiling its new dietary guidelines, which includes the new upside-down food pyramid, backing more protein and full-fat dairy in your diet.
Today, the lies stop. The new guidelines recognize that whole, nutrient-dense food is the most effective path to better health and lower health care costs. Protein and healthy fats are essential and were wrongly discouraged in prior dietary guidelines. As Secretary of Health and Human Services, my message is clear: eat real food.
Joining me now is the National Advisor for Nutrition, Health and Housing at the U.S. Department of Agriculture, Dr. Ben Carson. You were also up there with RFK Jr. when he made those comments yesterday. Mr. Secretary, thank you so much for joining us. You know, I was just thinking there are a few pure wins in life, but doctors now recommending full-fat dairy can be considered one of them. So tell us about these new health guidelines and what they will do to people if they follow them.
Well, basically, what we're trying to do is bring common sense back to dietary policy. When the dietary guidelines were first introduced in 1980, 45 years ago, it was to educate people about nutritious food. What has happened during those 45 years? The incidence of chronic diseases has skyrocketed. Children have become less healthy and obese. And here's the big one. Our life expectancy has been reversed. It's going down now instead of up. That's not the case with many other industrialized nations because they don't process their food the way we do. Our farmers, our ranchers are providing us with a good start, but then we take that food and we process it. We take all those nutrients out of it and replace it with artificial this, that, and the other. So it's very difficult for us to make progress, but this is the first time we've really had the cooperation of multiple federal agencies working together, recognizing that we do have a problem, but it's a correctable problem. And, you know, a lot of people say the problem is it's too expensive to eat healthy. Yes, we know you should do it, but some people can't afford it. Well, you have to look at the affordability spectrum on a big picture. You know, yes, it may cost a little more, although we're working on that too. But think of it like a high-powered race car. You're probably going to put, you know, premium gasoline in it. And then you say, well, maybe I'll just dilute that with a little water. Yeah. It'll still go, but not nearly as well.
Understood.
Then you say, I don't like the way it smells, so let's put some maple syrup in it. Well, pretty soon it stops altogether, and you got to replace the engine, which costs a lot more. So you got to look at the big picture, and it's much cheaper to prevent disease than it is to treat disease.
It certainly is. And, you know, here's a moment that we found interesting. It's something that Dr. Mehmet Oz said yesterday. You were there, so you already heard it, but let's play the tape for those who haven't. Watch this.
There is alcohol on these dietary guidelines, but the implication is don't have it for breakfast. Right, this should be something done in a small amount with hopefully some kind of an event that might have alcohol added. But the general move away from 2 glasses of men, 1 glass of women, there was never really good data to support that quantity of alcohol consumption.
So is the federal government recommending people drink alcohol? And if so, how much should we be drinking?
No, we're definitely not recommending that people drink it, but you know, we're saying, you know, pregnant women, people with a history of alcohol abuse in their family or in themselves, obviously should go nowhere near it. You know, the Bible says in Proverbs 20, strong drink is raging. Whosoever is deceived thereby is not wise. And it's very easy to get deceived. So we're saying you can, if you do it responsibly, if you feel that you absolutely need it, but we're not recommending that alcohol consumption be part of your daily routine.
Well, you are bringing common sense back to food guidelines to make America healthy again, and that is a very good thing. Dr. Carson, thank you so much for joining us.
Thank you.
I'm Steve Doocy.
I'm Brian Kilmeade.
And I'm Ainsley Earhart. And click here to subscribe to the Fox News YouTube page to catch our hottest interviews and most compelling analysis.